Hey you guys, welcome and welcome back to another video. Your girl is finally back at school. Like I said I would be, you guys, and yeah, I want to tell you guys what's been going on, give you guys a life update, and soon I want to start taking you along with me on my days, doing more vlogs and stuff. So I got my lunch here, so we're gonna talk and eat some lunch. So basically we were supposed to go back to school on the 16th. We didn't have school on the 15th because we had MLK Day. The 16th was our first day of school, supposedly, but it ended up snowing. So then the rest of the week it froze. And on Friday, they opened the university back. But our program didn't have class that day because they had faculty training, which worked out because, you guys, I cut my finger, okay? It's pretty much healed now, but like I cut it, I think the weekend before I was supposed to go back to school. I think, no, either the 7th or the 14th. It was one of those Sundays. And I had to get 5 stitches. And yeah, I had to keep it wrapped for a minute. I'm still keeping it wrapped a little bit for precaution. But whenever I go to clinic now, I just put a Band-Aid on. But yeah, so I had to get my stitches out last week. I keep putting Neosporin on it and cleaning it, you know, every day. Yeah, but I got my stitches taken out. So I'm fine now, you guys. Everything's okay. And I'm okay in clinic. Thankfully, it wasn't my dominant hand, because if it was, there probably would be some issues, you know. But thankfully, you know, everything's good now. So yeah, Monday was my first day. I saw 2 patients on Monday. Then I had clinic on, I didn't have clinic Tuesday. I was like on rotation on Tuesday. But then I was clinician again yesterday, and I'm clinician again today. But the only downfall about having classes on Tuesday, Thursdays is like I don't have enough time to really set up and look over my paperwork and all of that, especially if they're like a recall patient. Like I like to look at their paperwork and their notes and stuff to see what they had going on and how I can best, you know, service them. But I'm gonna have to get in clinic today and, you know, make sure I'm efficient with my time. I think a big thing for me is like time management. That was a big thing for me last spring. I feel like I'm very detailed and I don't move on if something isn't exactly right on how I like it. And I can't be like that, because then I won't have enough time to do what I need to do. You know what I'm saying? So, but the first day in clinic was a breath of fresh air. Honestly, I was like anxious, nervous, because it's been like, you know, almost a year since I've been in clinic. Over my period of not being in school, I did practice on my typing. So it wasn't like I was just going in, you know, blind. It was more so muscle memory and just making sure I remember what I've studied, you know. So yeah, and I have to study for national boards as well this semester. I haven't started again because I studied for it last year, and I took the boards in October, found out in September that I failed it by 1 point. And so I still feel like I remember a lot of the material. I'm just giving myself time to get acclimated in clinic again, and then I'm gonna study. Like I said, Monday was a breeze. My x-rays could have definitely been better. I'll say that. But I feel like, you know, as far as, you know, assessment, I'm not too bad. Like as far as exploring, probing, like calculus detecting, I feel like I'm getting better at that. That was something I really struggled with last year as well. And then Tuesday I was screeners. So screeners, they get people in for a 30-minute appointment to do a basic assessment like spot probing and spot exploring. I'll make note of it, and then we'll get a score for what that type of patient is, whether you're a class 1, 2, 3. And I feel like being screener on Tuesday really helped me with calculus detection a little bit better. I ended up being able to distinguish calculus a little bit better on a class 3 and a 2, so it was very beneficial for me. Today I have clinic. I'll be seeing 2 patients. I'll be seeing my friend, and then I have another patient I've never seen before come to clinic. So I'm praying that I can finish both of them today. I want to push myself because I feel like I can do this. But I'll give you guys a brief update on how everything went after clinic today. Life update. Whoa. Okay, it's raining outside. Disregard the sound from the windshield wipers. I wonder what happened. Somebody just got in a wreck. We're on our way to pick up some food. PJ got Firehouse. I'm getting Chipotle. But anyways, this is a little update from last week. The first clip you saw was last Thursday. So it's been a whole week later. It's now Saturday of the next week. So I just wanted to give you guys an update of last Thursday and my week in clinic this week. So last Thursday, it went okay. It could have went much better. I think I messed up a lot on time management. I was falling behind on my first patient, which made me fall behind on the second patient, and the second patient ended up wanting to leave early. So yeah, but this patient also, she wants to be seen in one appointment, and I knew that. So I like to look at detail a lot, and I just don't want to miss anything. Y'all know in dental hygiene school, like if you miss one thing, like they dock about 5 points off, you know, depending on what it is. So yeah, but I definitely know that I need to work on the time management area, which I've gotten better this week. I only had 1 day in clinic. Well, I guess you can technically say 2. I was in regular clinic at the school. I saw class 1 and I had to do a mouth guard for her. Since she was a new patient, I had to do new patient x-rays, which is an FMX and Pano. I also had to get all my documentation in order before checking in, and then I had to do impressions on her, run to the back real quick, pour up the impressions, and then begin cleaning her. So I did the whole cleaning process, you know, the ultrasonic, hand scaling, and then polish, floss. Then I ran to the back, I trimmed the pour up, and then I created the mouth guards. It was very, very, very intense that day, but I got it done. Just knowing that I had to work on time management last week, I was very proud of myself that I got all of that done. Because when you have a person that wants impressions, whether it's a mouth guard or whitening, impression does take maybe 10 minutes, and then on top of the x-rays, it can take up a lot of time. And with somebody that wants whitening or mouth guards, you have to do a whole separate appointment for them. So I saw this patient all day and I got all of that done, so I was super proud of myself. And then Thursday this week I went to Riser, so I saw 3 kids. I got a couple of requirements done. So yeah, it was a pretty good week. Next week will be a busy week because I have 3 days in clinic. I'm seeing basically my cousins, and then I'll be seeing perio maintenance patients, 2 other perio maintenance patients. So yeah, my parents were originally supposed to come, but we're gonna reschedule them to March. They live all the way in Arlington, so I didn't want them to have to do too much here lately. And then it's Mardi Gras coming up. There's already been parades and stuff like that, so we're gonna just move their stuff to March or maybe April. So yeah, that's a life update or dental hygiene update. Today I got to do a lot of studying, a lot of review. Oh, I also the first week of school we didn't get to do remediation. This week we went over 3 instruments. We went over the SN135, which is a universal scaler. No, it's a hybrid. So it's a scaler and kind of a curette, but it kind of resembles the SN130, the ST5040, sorry y'all. It kind of is the same way, because on the posteriors, not only can you go distally and then turn it, you can go buccal-facial and then mesially and lingual. We went over the Gracies, which is area specific. The 1112 is for buccal-facial, mesial, and then the Gracie 1314, which is only distal of the posterior. So I really got to practice more on the Gracies because I realized I don't use those less often. My go-to instrument is the SN135 because you can easily pick it up and just go anywhere in the mouth. But I do know with Gracies you can basically polish off anything you missed with the scalers. So with that being said, I got to learn how to use any and every instrument. So my instructor told me to work a lot on the Gracies because I'm pretty good with the SN135, being that I use it so much in clinic, you know. So yeah, pretty proud of myself for doing really good this week. I'm gonna work on those instruments, and I have a few assignments due on Monday. Main thing is time management, like I said. So I want to vlog for you guys and take you guys along with me on, you know, a couple days, maybe a weekly vlog, maybe a daily vlog. We'll see how everything pans out. Now that I got like the first 2 weeks in with school, I can see where I can kind of move with the vlogging. So yeah, if you like this video, you enjoyed it, just make sure to like, comment, and subscribe. Thank you guys for watching, and I'll catch you in the next one. Bye.